there right now. Could you wait
May
one
as well.
minute?
May is here.
Nice to see you again.
Thank you.
Hello, Mr. Mayor.
How are you?
I'm fine, yeah.
Don't I know?
Shirley Barrett. How are you, Mr. Mayor? Congressman Weiss. Mayor.
Hi.
Yes. Oh, Harry Diaz, who put the circus together for us. Mayor Koch.
Okay.
Mayor Koch, would you make a statement of your concern about
Sure. Well, what is very important about this particular evening is that the gay community and the supporters of the gay community are demonstrating their outrage at the fact that not enough has been done to deal with AIDS, a disease that is devastating in its impact. Primarily on gay men, but not limited to gay men, others as well. But it wouldn't make any difference if it were limited solely to the gay community. It is the obligation of us all to do what is required to find what causes it and provide the dollars to find the cure. Now, the city of New York is doing what it can, and one of the things that we're very pleased about is that Dr. David Senser, our head of our health department, Department of Health, has gotten the Social Security Agency, with the support of the members of Congress, Teddy Weiss and others, to recognize AIDS as one of the debilitating diseases that makes you eligible for SSI benefits where you're not able to work. And the city of New York has about half of the cases of AIDS. There are about 1,200 in the country that have been diagnosed, about 600 in the city of New York. And of the 600, about 140 or a little more than that are being treated in city municipal hospitals. We, the city, will do whatever is required to be of assistance to the people who are afflicted with the disease. We will urge upon our members of Congress and the President, and I have with others sent communications to the appropriate chairman of the congressional committees and the President himself, asking for additional appropriations to deal with AIDS.
Resources and funds will the city commit?
Well, the city has already committed several $100,000. The city is obviously not the agency of government that can deal with finding the cure. It has to be done on a national level. We're not equipped to do that. Each case that we have in our hospitals, for example, these are city hospitals, municipal hospitals, each AIDS case is estimated to cost over $100,000. Those are city dollars, ultimately, that are paid for most of those expenditures, and we will do it. We will do whatever is within our power to do, and as the mayor of the city of New York, whatever is within my power to direct our agencies to do, you can count on me. I will do it.
But the San Francisco city government has come up with funds.
And so have we.
From what agency?
Well, the agency doesn't necessarily come up with the funds. We give financed the medical aspect by the federal government, not by the city government. We're not able, from a scientific point of view, we don't have the doctors who can do that kind of research. That's done on a federal level. But we're going to do whatever we can do to make sure the federal government does its part, and whatever we are capable of doing, as, for example, providing the health care in the hospitals, we are doing.
Mayor Koch, it said that federally they spent $10 million on the Tylenol scare in 2 days, but not that much has been spent in 2 years of AIDS. Do you have any comment on that?
It is outrageous that we don't provide the funds that are required to find what is causing AIDS and to deal with it from the point of view of locating a cure. And that is why all of us, whether you're in government or out of government, should be advising your legislators and the President of the need to provide federal funding for medical research to do the job.
You think there's homophobia in
I'm sorry, let me get him. What?
Have you talked to the President yourself about AIDS?
I have communicated with him by letter.
You think there's homophobia in the White House?
I don't know whether there's homophobia in the White House or not, and that would have no relationship at all, whether they're homophobic or not, to deal with an epidemic, a disease that affects human beings, whether they are homosexual or heterosexual. This has nothing to do with lifestyle. This has nothing to do with your own psyche. This has nothing to do with your prejudices. This is a medical matter and has to be addressed immediately.
Thank you.
Excuse me,
Thank
the
you.
show must go on.
Did you get that? Okay.